Understanding Crohn's. The symptoms of Crohn's can be vague, which sometimes means that it is not always easy to detect. If you experience any of the following symptoms for a prolonged period, it is important to visit your doctor. The most common symptoms of Crohn's are abdominal pain, fever, weight loss, tiredness, loss of appetite, and increased bowel movements. Your doctor will perform tests to confirm a diagnosis of Crohn's. Patients may also experience further symptoms affecting other parts of the body. These include joint pain, osteoporosis, liver inflammation, anemia, skin conditions, and eye problems. So, what is Crohn's? Crohn's is an inflammatory bowel disease that can cause inflammation and swelling throughout the GI tract. The GI tract is a series of organs responsible for processing food and waste. These organs include the mouth, esophagus, stomach, small intestine, and large intestine. Crohn's can affect any area of the GI tract, but it most commonly occurs in the final section of the small intestine called the ileum. This is where the small and large intestines meet. Although the causes of Crohn's disease are still unknown, there are combinations of factors that are believed to cause and aggravate the illness. These include genetics. Genes you inherit from your parents may increase your risk of developing Crohn's. This is different from a hereditary condition. Crohn's isn't believed to be passed down from your parents, but rather a combination of their genes causes you to be more susceptible to developing Crohn's. Smoking. People who smoke are at an increased risk of developing Crohn's. Sufferers who smoke are more likely to experience inflammation and are at greater risk of needing surgery. The immune system, an abnormal response from the immune system that causes it to attack healthy bacteria or healthy tissues in the gut. And environmental factors. Cases of Crohn's are much higher in developed areas of the world. This suggests that pollution, medications, and lifestyle may play a role in Crohn's disease. It is thought your genetics make you more susceptible to developing Crohn's, with factors such as your environment then triggering this susceptibility. Many sufferers have found that other lifestyle factors can aggravate the symptoms of their disease, for example, certain food and stress. This is different for each sufferer. To understand Crohn's, we must first understand inflammation. Inflammation is the body's response to dealing with harmful bacteria. If you cut yourself, bacteria can gain access to your body. Mast cells detect this and release histamine. Histamine increases blood flow to the affected area, allowing immune cells to consume and destroy the bacteria. The increased blood flow is what causes redness, pain, and swelling. After a few days, when the harmful bacteria has been dealt with, the immune system switches off and inflammation fades. As with a normal injury, it is believed that Crohn's triggers an inflammatory response to attack bacteria in the GI tract. But because Crohn's is a chronic illness, inflammation can remain for weeks or months at a time, causing the immune system to attack healthy tissue after the bacteria is cleared. This causes ulcers, resulting in the walls of the intestine becoming stiff and narrow. This is what causes the onset of Crohn's symptoms. Over time, the intestine wall may become blocked or wear away entirely. As we travel through the large intestine, we can see a healthy portion of the colon compared to an area affected by Crohn's. There are different types of medication and surgery that can help relieve symptoms depending on how the individual is affected, although none will cure the condition. Many Crohn's sufferers can remain in remission for years on a combination of medications. Sometimes these fail or the disease becomes more serious. In these cases, surgery is used. These include stricture plastic. A stricture plastic is a surgical procedure to widen the narrow area of the small intestine in an area affected by Crohn's. This is performed by cutting the affected area lengthwise and restitching in the opposite direction. This means that no part of the intestine is removed. Resection. Resection surgery may be required if the narrowed areas of the intestine are long or affected in several areas close together. This is where the affected area of the intestine is removed and the healthy sections are sewn together. Removal of the diseased section may allow the patient relief from Crohn's symptoms for many years. Colectomy. If the disease becomes more severe, a colectomy may be required. This is when either part of or the entire colon is removed. If the rectum is unaffected by Crohn's, it may be possible to connect it directly to the small intestine. Protocolectomy and ileostomy. If Crohn's is present in both the colon and rectum, a surgery called Colectomy is performed to remove both of these areas. This is then followed by an ileostomy, where the ileum is diverted through a hole made in the lower abdomen called a stoma. A bag is placed over the stoma to collect waste products that would usually pass through the colon. It is important that people with Crohn's disease consult with their doctors on how to manage the condition so that the condition doesn't manage them. Treatments and surgery means that patients can go months or years without experiencing flare-ups, and this can help them lead a normal life.